Have you heard of the Liebscher-Bracht osteopressure? You can do a lot against pain by pressing the right spots. In this video, I will show you how easy it is and how you can make the pressing easier with household items or our osteopressure tools. And I will explain to you the most important rules and pressure spots, especially in case of neck pain. If you are not familiar with this Liebscher-Bracht osteopressure yet, here is a brief explanation for you. We press areas on the body, specifically on the bone, and thus we want to reduce the excessive tension of the muscles, which we consider to be mainly responsible for many pains. And many years ago, we did a small application study where we were able to prove that this tension is reduced by pressing. Before we press the neck spots, a brief explanation and the most important rules. So the points, I will show you them shortly, and then you should try to find them on your body in order to press on them. And then you realize there are areas on the bones that are quite insensitive to pain. You don't feel anything there. And there are others which are highly sensitive. Even when you press a little, it hurts a lot. These are the spots you should press. So the points that hurt the most are also the ones that contribute the most to pain relief. This has been shown for many years, and we now know that it usually works this way. And then you practically stay on it and wait until the intensity decreases. Many say then, oh, I'll get used to it. But we believe from our model, the model we have developed over the years of practice, that the body really reacts and it reduces tension, and thereby also reduces the sensitivity of these points. And if you now ask, how long do we have to press on such a point? Then I can say maybe, if it goes quickly, 1 minute. If it takes longer, maybe 3 minutes. And then it's always the same process. You press on it, you notice, oh, I don't want to press more, otherwise it hurts too much. You have to limit it so that it is just bearable, just a comfortable pain, and then you stay on it 10 seconds, 20 seconds, and then you notice, oh, now it's somehow less sensitive. Now I'm getting used to it. As I said before, yes. And then you press a little more again, and you do that 2 or 3 times. You press more, and then at some point the spot normalizes and becomes much less painful than at the beginning of pressing, and then you move on to the next point. You see, I have turned the chair around so that you can see me from behind, but from the front I want to show you this arm position that has proven very effective. You practically take your right elbow in your left hand, and then you can bring your right arm nicely back with your left hand. Without this help, it is sometimes a little difficult. And then I sit down like this. And now you see, now here is my hand. And now feel here. Yes, feel here. And you notice a bone edge here. And let's look it on the skeleton. That is exactly this bone edge that you see here. Yes, you can feel it there, exactly this bone edge here. And on this bone edge, you go practically from above. It's best to start in the middle. There you also notice that it is usually a bit sensitive. And then you go outwards, and then you feel this area right here. And then you press on it with your fingers and notice, aha, it's sensitive there, and then you stay on it, go directly on it with 1 or 2 fingers at the same time maybe, then you wait until it calms down, then you go a little further. And very often it is like this, maybe you feel that too, that the further you go outwards, the more sensitive it becomes, and that means the further you go outwards, the more you are on points that have high tension, which are related to muscle fibers. We want to reduce the tension, and then you go a little further, and then you notice if you slide around this edge a bit, from where you can trigger the greatest sensitivity, you just stay there, you breathe, and simply observe how it calms down. Always move half a centimeter to the side, and this point, you may notice the word point is a bit confusing, so our spots, which we have, are 27 for you at home, which are easy to find, and you can work on them. And the therapists, doctors, physiotherapists, and naturopaths who have learned our therapy, they have 72. And these points are either correct points, or they are lines, or they are areas, but we call them uniformly points, just in case you are wondering now that we practically press one point next to the other. This is because this whole line counts as a point, and you always go further out, and it is always advisable, as with the exercises, when you do the Liebscher-Bracht exercises, to breathe in deeply and breathe out deeply, because it has been shown that the deeper you breathe, the more relaxed you are. The better these points relax, and at some point you have arrived pretty far outside, and when you are completely outside, then do the same on the other side. Take your elbow again, this time in the right hand, left elbow in right hand. And you help the arm get into a good position, and you look for this line. I'll show it to you again. Yes, now it's this one here, where you can also see that red line. That's exactly the point that forms a line. You start quite far inside, go from the top, and just test a little to see where you are here. Here we go, yes. And then you press along this line from the top again, always keeping the pressure. I notice, for example, that my right side is significantly more sensitive than the left. I must have done something one-sided again. I have no pain, but these points are also sensitive when the tension of the muscles is already too high. So don't be surprised if you are completely pain-free, and yet you find areas where the bones are very sensitive, then you always go further out. And please do it at home as well, searching bit by bit for where the most sensitive spots are. And the more often you do it, the more confident you will become in finding sensitive points, and you will also get to know your body's areas. Your own personal difficulties ultimately show where there is too much tension in your system, in your muscles. Then you get to know them better, can find them better, always target them, and if you can't cope with the pain in these points. Then feel free to visit one of our trained doctors or therapists. They'll be happy to teach you as well. When you get treated by them, just ask, "Where can I press myself?" They will show you and help you find the points more easily if you're ever unsure about where exactly the point is. Now that we've done both sides, I want to show you something. If you've noticed that your fingers are having a bit of trouble, especially if you're not used to it or haven't practiced much, you can just use our osteopressure tool set. or from your house a cork or any small ball, which is a bit firmer, so not completely soft, a bit harder. Tennis ball would be too big, must be smaller than a tennis ball and a bit harder, but still overall soft. Here we have this thing called EPP, a soft recyclable material, and then you'll notice, oh, I can feel it right away. With this, you can apply pressure quite intensely without using much force with your hand, so it just makes it easier. Many therapists and doctors use this pressure set when working on patients, and you simply follow along here, and if you have something like this, you will immediately notice the difference. I can feel it right away in comparison. It's much more intense. You need much less effort to trigger more. Yes, and on the other side, it would be similar. And now we are going to focus on the neck. Surprisingly, there are 2 points on the front side. Let me show you these points again on the skeleton so you have a good picture. Now you can let your arms down. Look, this point here at the upper end of the sternum, can you see it? Yes, right there, once on the right side and once on the left side. Try it yourself. Go there, notice, aha, there is the sternum ending, a little higher. Be careful, you are pressing into your throat, into the larynx, so below the larynx, we don't want that. Instead, you go to this bony edge, which I have here now. That is exactly this upper bony edge of the sternum. And then you go a bit. Let's start on the right side, from your own perspective, and turn your head. You'll notice there's a tendon there. Can you see it, Martin? Yes, exactly. You can see it clearly here. In this image, the tendon comes down, and you can feel how it disappears into the sternum. That's where it's anchored. And from there, you go a bit lower, straighten your head again, and press from the front. Then you'll notice, oh, that point is sensitive, and that's it. When it comes to neck pain, a very, very important point is the sternocleidomastoid muscle, which turns the head, that's why it's called that, and it has been shown to contribute significantly to neck tension and neck pain. Yes, if you press here once, then you would look to the other side. And then the tendon comes out again. Follow the tendon along, and you'll notice the end at the bone. Go a bit lower, straighten your head again, and you'll feel, oh, that's sensitive again. Bingo. Wherever it's sensitive, we can do something about it. As with exercises, when you do a Liebscher-Bracht exercise and realize, oh my goodness, this is really intense, then you are exactly in the exercise that is good for you. Yes, and here as well, the points that are most sensitive are the points that can help the most. Press from the front, so again, using the simple version with our pressing tool set or something comparable from around the house, maybe a wine cork that you carve into a slightly rounded shape, you can hold it comfortably with both hands right here. And I notice that I need to be careful because it's much more intense with the tool. It shouldn't be too strong. You shouldn't push it too far so it doesn't become negative. It needs to remain just within the range of positive and tolerable pain, similar to the Liebscher and Bracht exercises. Okay, did you actually know that you can press yourself? Write a comment, and if you know people who want to help themselves, we are the big self-help providers, so to speak. We want all people to learn to help themselves through the Liebscher-Bracht exercises. Through the Liebscher-Bracht osteopressure, through the Liebscher-Bracht fascia roll massage, through all these things we want to contribute, then pass on the video, share it in a WhatsApp group or in other channels, especially to the people who have problems with pain and want to do something themselves, and there are many, many of them. If you'd like to do something for your whole body, from top to bottom, to feel better, address any pain, and become more flexible and relaxed overall, click here and join in on this routine. It doesn't have to be right now, but maybe later. Or this evening, whenever you have time, yes. And down here, you can subscribe to our channel. Why is it important to also activate the bell? It's so YouTube can remind you of new videos. So feel free to try it out, even if you're not addressed directly here, because it might help you feel better. Have fun!